Would you like free audiobooks? Click the link in the description. Question 1. Therapeutic communication techniques. A nurse is caring for a patient who has just been informed that they have a chronic illness. The patient appears to be anxious and is asking several questions about their condition. Which of the following responses by the nurse demonstrates the use of therapeutic communication? A. Don't worry, many people live long lives with chronic illnesses. B. Why are you feeling anxious? Your condition is manageable with medication. C. It seems like you're feeling overwhelmed. What concerns you the most? D. You should focus on the positive side and be thankful it's not worse. Correct answer, C. Rationale. Option C is the best answer because it validates the patient's feelings and invites the patient to share more about their specific concerns, demonstrating the nurse's empathy and willingness to listen. This is a key element of therapeutic communication. A is non-therapeutic because it minimizes the patient's feelings. B is confrontational and may make the patient feel judged. D is dismissive of the patient's concerns and also minimizes their feelings. Question 2. Documentation standards. Which of the following documentation entries is most appropriate according to nursing documentation standards? A. Patient is feeling better today. B. Patient states, I feel like my condition is improving. C. Patient seems to be in less pain than yesterday. D. Patient's vital signs within normal limits, ambulated with assistance, tolerated diet well. Correct answer, D. Rationale. Option D provides specific, measurable information that follows the standards for objective and accurate nursing documentation. It gives clear evidence of the patient's status and nursing interventions. B is a direct quote, which is good practice, but doesn't provide a comprehensive view. A and C are subjective and vague, lacking the specificity and objectivity required in professional nursing documentation. Question 3. Handling confidential information. A nurse overhears another healthcare worker discussing a patient's HIV status in a public area of the hospital where visitors are present. What is the most appropriate action for the nurse to take? A. Join the conversation and remind the healthcare worker to discuss patient information privately. B. Report the incident to the healthcare worker's supervisor immediately. C. Politely interrupt and suggest moving the conversation to a private area. D. Do nothing, as it's not the nurse's responsibility to monitor every conversation. Correct answer, C. Rationale. The most appropriate and immediate action is C, which addresses the issue directly and respectfully, reminding the healthcare worker about the importance of maintaining patient confidentiality in accordance with HIPAA regulations. A. Could be seen as confrontational or endorsing the breach by participating. B is a subsequent step if the behavior continues. D ignores the nurse's duty to protect patient confidentiality. Question 4. Active listening. A patient is expressing frustration about the long wait times for treatment at the clinic. Which response by the nurse demonstrates active listening? A. I understand why you're upset. Many patients feel the same way. B. At least you're getting the care you need. Some people have no access to healthcare at all. C. You're right. The waiting times can be long. What aspect of the waiting is most frustrating to you? D. I'll pass your complaint on to the administration. There's nothing I can do. Correct answer, C. Rationale. Option C demonstrates active listening by acknowledging the patient's feelings, validating their concern, and inviting them to elaborate, which can help identify specific issues that may be addressed. A sympathizes, but doesn't encourage further discussion. B minimizes the patient's feelings by comparing them to others, which is not helpful. D dismisses the patient's concern and removes the nurse from being a part of the solution. Question 5. Effective communication with colleagues. A nurse needs to communicate a patient's change in condition to the attending physician. Which of the following methods is most appropriate? A. Sending a detailed email to the physician explaining the patient's symptoms and changes. B. Waiting for the physician's next rounds to discuss the patient's condition in person. C. Using the SBAR, situation, background, assessment, recommendation, format to communicate the change over the phone. D. Leaving a note in the patient's medical chart for the physician to find. Correct answer, C. Rationale: using the SBAR format to communicate important patient information over the phone is the most effective and immediate way to ensure the physician is informed about the patient's condition and can make timely decisions. A may not be seen in a timely manner. B. Delays potentially urgent communication. D. Lacks immediacy and personal interaction, which may lead to misunderstandings or oversights. Question 6. Nonverbal communication. During a patient interview, the nurse notices that the patient is avoiding eye contact, fidgeting, and has crossed arms. Which interpretation of these nonverbal cues is most accurate? A. The patient is likely comfortable and content with the care being provided. B. These cues suggest the patient may be feeling defensive or anxious. C. The patient is showing signs of aggression and potential violence. D. Such behavior indicates the patient is not interested in the conversation. Correct answer, B. Rationale: the correct interpretation is B, as avoiding eye contact, fidgeting, and crossing arms are common nonverbal cues associated with anxiety or defensiveness. Recognizing these signs allows the nurse to adjust their approach to make the patient feel more at ease. A is incorrect because these behaviors typically do not signify comfort. C may be an overinterpretation without other signs of aggression. D could be considered, but it's more likely the patient is anxious rather than disinterested. Question 7. Informed consent. A patient scheduled for surgery is confused about the procedure. Which action by the nurse demonstrates understanding of informed consent principles? A. Proceeding to reassure the patient that the surgery team is highly skilled. B. Explaining the risks and benefits of the procedure in detail to the patient. C. Encouraging the patient to sign the consent form quickly to avoid delays. D. Informing the surgeon that the patient requires further clarification before giving consent. Correct answer, D. Rationale: D is the correct action, as it respects the patient's right to be fully informed before giving consent. It is the surgeon's responsibility to ensure the patient understands the procedure, risks, and benefits, not just the nurse's role to facilitate the process. A might provide comfort but doesn't address the patient's need for information. B oversteps the nurse's scope if the nurse is not fully equipped to explain surgical details. C disregards the patient's autonomy and right to informed consent. Question 8. Addressing language barriers. A nurse is caring for a patient who speaks a language the nurse does not understand. What is the most appropriate action to ensure effective communication? A. Using translation apps on a smartphone to communicate with the patient. B. Asking family members to translate the medical information for the patient. C. Arranging for a professional medical interpreter to assist with communication. D. Speaking loudly and slowly in English to make oneself understood. Correct answer, C. Rationale: C is the most appropriate and professional action, ensuring accurate and confidential communication between the healthcare provider and the patient. Professional interpreters are trained to handle medical terminology and sensitive information. A could be used as a temporary measure but may not be accurate for medical terms. B risks breaches of confidentiality and accuracy. D is ineffective and could be perceived as disrespectful. Question 9. Handling a complaint. A patient complains about the rude behavior of a staff member. Which initial action by the nurse demonstrates effective handling of the situation? A. Telling the patient that the staff member is usually very professional and dismissing the complaint. B. Assuring the patient that the complaint will be addressed and asking for specific details about the incident. C. Advising the patient to directly confront the staff member about their behavior. D. Ignoring the complaint to avoid conflict within the team. Correct answer, B. Rationale. B demonstrates the nurse's willingness to listen to the patient's concerns and take them seriously, an important step in conflict resolution and maintaining trust. It also gathers necessary information to address the issue appropriately. A dismisses the patient's feelings, C could escalate the conflict, and D neglects the nurse's responsibility to address patient concerns and maintain a safe and respectful environment. Question 10. Teaching a new procedure to a patient. A nurse needs to teach a patient how to administer a new medication via a self-injection. Which approach ensures effective patient education? A. Providing a pamphlet about the medication and assuming the patient will read it. B. Demonstrating the injection technique once and then watching the patient attempt it. C. Giving verbal instructions without visual aids, expecting the patient to understand. D. Explaining the process, demonstrating it, allowing the patient to practice, and then evaluating the patient's technique. Correct answer. D. Rationale. D is the most comprehensive and effective approach, incorporating explanation, demonstration, practice, and evaluation, which are key elements in teaching a new skill. This method caters to different learning styles and ensures the patient is competent and confident in performing the procedure. A might not address all patient questions or learning preferences. B is a start but may not be sufficient for mastery without practice and feedback. C lacks the visual and hands-on aspects crucial for learning a physical skill. Question 11. Prioritizing patient concerns. A nurse is triaging patients in an emergency department. Which patient should the nurse prioritize for immediate assessment? A. A patient with a headache and a history of migraines. B. A patient with chest pain and shortness of breath. C. A patient with a minor laceration on the forearm. D. A patient with a sprained ankle and swelling. Correct answer, B. Rationale. B should be prioritized for immediate assessment because chest pain and shortness of breath can indicate life-threatening conditions such as a heart attack or pulmonary embolism. It's critical to assess and address potentially fatal conditions first. A, C, and D represent conditions that, while requiring medical attention, are less likely to be immediately life-threatening compared to the symptoms described in B. Question 12. Communicating with a distressed family member. A family member is upset because they feel their loved one is not receiving adequate attention in the hospital. Which response by the nurse is most appropriate? A. We are very busy right now, but your loved one is stable. B. Let's discuss your concerns so I can understand how to help better. C. You should be patient. Everyone is doing their best. D. I'll let the doctor know you're unhappy with the care. Correct answer. B. Rationale. B is the most appropriate response as it acknowledges the family member's distress and opens a dialogue to better understand their concerns, potentially identifying areas for improvement in care or communication. A and C are dismissive and likely to increase the family member's distress. D deflects the concern without addressing it directly or providing immediate support. Question 13. Ethical dilemma in patient care. A patient refuses a life-saving blood transfusion due to religious beliefs. Which action by the nurse respects the patient's autonomy while also addressing the situation ethically? A. Proceeding with the transfusion against the patient's wishes, prioritizing the preservation of life. B. Documenting the patient's decision and ensuring the patient understands the potential consequences. C. Trying to convince the patient to accept the transfusion by explaining its benefits. D. Ignoring the patient's wishes and seeking a court order to proceed with the treatment. Correct answer. B. Rationale. B respects the patient's right to make informed decisions about their care, even if the decision is against medical advice. It is crucial to ensure that the patient fully understands the potential outcomes of their choice. A and D violate the patient's autonomy and rights. C, while well-intentioned, must be approached with sensitivity to not coerce the patient, respecting their beliefs and decisions. Question 14, dealing with medication error. A nurse realizes they have administered a medication to a patient at the wrong time. What is the first action the nurse should take? A. Document the error in the patient's chart and move on. B. Monitor the patient for any adverse effects. C. Report the error to the supervisor and fill out an incident report. D. Try to cover up the mistake to avoid disciplinary action. Correct answer. B. Rationale. B is the immediate priority to ensure patient safety by monitoring for any potential adverse effects from the medication error. C is also a critical step but comes after ensuring the patient's safety. A is part of the process but does not precede patient monitoring. D is unethical and can lead to further harm. Question 15. Effective delegation to nursing assistants. A nurse is overseeing the care of multiple patients and needs to delegate tasks to nursing assistants. Which task is most appropriate to delegate? A. Assessing a patient's new onset of chest pain. B. Administering insulin to a diabetic patient. C. Helping a patient with mobility exercises as prescribed. D. Evaluating a patient's response to a new medication. Correct answer. C. Rationale. C is an appropriate task to delegate to a nursing assistant, as it involves assisting with activities of daily living and mobility exercises, which are within the scope of practice for nursing assistants. A and D involve assessment and evaluation, which require clinical judgment and must be performed by a nurse. B involves medication administration, also a task that should be performed by licensed nursing staff. Question 16, addressing patient anxiety. A patient scheduled for surgery the following day expresses increasing anxiety about the procedure. Which nursing intervention is most appropriate to address the patient's anxiety? A. Advise the patient to relax and stop worrying because the surgery is routine. B. Offer to provide information about the surgery and answer any questions the patient might have. C. Suggest the patient talk to other patients who have had the same surgery to ease their worries. D. Ignore the patient's anxiety as it is a normal response to surgery. Correct answer, B. Rationale. B is the most appropriate response, as it acknowledges the patient's anxiety and offers a constructive way to alleviate it by providing information and answering questions, thereby empowering the patient with knowledge. A is dismissive and does not validate the patient's feelings. C could be helpful, but may also increase anxiety if the patient hears about negative experiences. D neglects the nurse's role in providing emotional support and education. Question 17. Maintaining patient confidentiality. A nurse is discussing patient care over the phone in a public area. Which action best maintains patient confidentiality? A. Using coded language to discuss the patient's condition. B. Moving to a private area where the conversation cannot be overheard. C. Speaking in a low voice to minimize the chance of being overheard. D. Ensuring that the patient's name is not mentioned during the conversation. Correct answer. B. Rationale. B is the best action to maintain patient confidentiality, as it ensures that sensitive information is not shared in a place where it can be overheard by unauthorized individuals. A may reduce the risk but still poses a potential breach of confidentiality. C and D are steps to minimize risk but do not adequately safeguard against the possibility of eavesdropping. Question 18, promoting patient safety. Which action by the nurse demonstrates a commitment to patient safety during medication administration? A. Relying on memory for dosages because the nurse is experienced. B. Checking the patient's medication allergies each time before administering medication. C. Administering medication as soon as it is received from the pharmacy without double-checking. D. Skipping the patient identification process if the nurse knows the patient well. Correct answer. B. Rationale. B demonstrates a commitment to patient safety by verifying the patient's medication allergies each time before administration, which is a critical step in preventing adverse drug reactions. A. Is unsafe and can lead to medication errors. C. Disregards the importance of double-checking medication orders, a key safety protocol. D. Ignores a fundamental safety measure of confirming patient identity, which is essential regardless of familiarity. Question 19. Responding to a fall. A patient falls in the hallway while trying to walk without assistance. After ensuring the patient is safe and assessing for injuries, what is the nurse's next step? A. Reprimand the patient for not calling for help. B. Document the fall in the patient's health record and notify the healthcare team. C. Tell the patient that restrictions will be placed on their mobility. D. Ignore the incident to avoid causing embarrassment to the patient. Correct answer, B. Rationale. B is the correct step as it ensures that the incident is officially recorded and communicated to the healthcare team for appropriate follow-up and intervention. It also helps in identifying potential risks and implementing strategies to prevent future falls. A is inappropriate and may discourage the patient from seeking help in the future. C might be necessary depending on the assessment, but should be approached in a way that supports the patient's autonomy and safety. D neglects the nurse's responsibility to report and address safety incidents. Question 20. Interdisciplinary collaboration. A nurse is planning care for a patient with complex needs requiring input from multiple healthcare professionals. Which approach best demonstrates effective interdisciplinary collaboration? A. Making all the care decisions independently to expedite the process. B. Organizing a team meeting to discuss and coordinate the patient's care plan. C. Assigning tasks to team members without discussing the overall plan. D. Consulting with only the most senior doctor about the patient's care. Correct answer. B. Rationale. B is the best approach as it involves organizing a meeting with all relevant healthcare professionals to discuss and coordinate the patient's care. This ensures that everyone is informed, perspectives are shared, and the care plan is comprehensive and cohesive. A disregards the valuable input other disciplines can provide. C does not ensure that care is coordinated or that all aspects of the patient's needs are addressed. D limits the breadth of expertise and perspectives that could benefit the patient's care. Question 21. Advocating for patient rights. A patient expresses a desire not to have a specific medical treatment due to personal beliefs. The healthcare team believes the treatment is in the patient's best interest. How should the nurse act in this situation? A. Insist on the treatment, emphasizing its benefits and the risks of refusal. B. Respect the patient's decision and support them in communicating their wishes to the healthcare team. C. Avoid discussing the treatment with the patient to prevent further conflict. D. Persuade the patient by presenting the negative outcomes of not undergoing the treatment. Correct answer. B. Rationale. B is the correct action, as it respects the patient's autonomy and right to make informed decisions about their own care, even if these decisions go against medical advice. The nurse should advocate for the patient's wishes and help facilitate communication between the patient and the healthcare team to ensure that all parties understand the patient's perspective. A and D could be perceived as coercive and disrespectful of the patient's rights. C neglects the nurse's role as an advocate and fails to address the potential need for alternative care plans or supportive measures. Question 22. Addressing cultural sensitivity in care. A patient's cultural beliefs include using traditional healing practices alongside conventional medical treatments. Which approach by the nurse best demonstrates cultural sensitivity? A. Discouraging the use of traditional practices as they are not evidence-based. B. Acknowledging and incorporating the patient's beliefs into the care plan where possible. C. Ignoring the patient's beliefs as irrelevant to modern medical care. D. Informing the patient that hospital policy prohibits non-medical practices. Correct answer. B. Rationale. B. Demonstrates cultural sensitivity by acknowledging and respecting the patient's beliefs and seeking ways to integrate them into the care plan, as long as they do not interfere with the efficacy of medical treatments or the safety of the patient. This approach promotes holistic care and patient satisfaction. A and C dismiss the importance of cultural beliefs in the patient's healing process, potentially alienating the patient. D, while potentially true in some settings, should be approached carefully, with efforts made to accommodate the patient's needs within policy limitations. Question 23. Enhancing patient education. A patient with diabetes needs to learn how to manage their condition, including diet, exercise, and glucose monitoring. Which strategy by the nurse will most effectively enhance patient education? A. Providing a comprehensive lecture on diabetes management in one session. B. Offering written materials without follow-up discussion or demonstration. C. Tailoring the education to the patient's learning style and providing hands-on demonstrations. D. Advising the patient to search for information online to learn at their own pace. Correct answer. C. Rationale. C is the most effective strategy, as it considers the patient's preferred learning style and includes hands-on demonstrations, which can improve understanding and retention of complex information like diabetes management. Tailoring education fosters engagement and empowerment. A may overwhelm the patient with too much information at once. B lacks interactive elements and may not address all patient questions or needs. D assumes the patient has the skills and resources to find accurate and relevant information, which may not be the case. Question 24. Responding to end-of-life care preferences. A patient with a terminal illness expresses a wish to discontinue aggressive treatment and focus on palliative care. How should the nurse respond? A. Encouraging the patient to reconsider and continue treatment for the sake of their family. B. Supporting the patient's decision and working with the healthcare team to adjust the care plan. C. Telling the patient that it's too soon to give up on potentially curative treatments. D. Informing the patient about the success rates of aggressive treatments to persuade them to continue. Correct answer. B. Rationale. B respects the patient's autonomy and end-of-life care preferences, supporting their decision to focus on comfort and quality of life rather than pursuing aggressive treatments with unlikely benefits. The nurse should facilitate communication with the healthcare team to ensure the care plan reflects the patient's wishes. A, C, and D disregard the patient's expressed desires and may contribute to distress and a sense of disempowerment at a vulnerable time. Question 25. Managing time effectively. A nurse is responsible for caring for multiple patients with varying degrees of acuity. Which strategy demonstrates effective time management? A. Completing tasks for the most cooperative patients first to maximize efficiency. B. Prioritizing tasks based on patient acuity and the urgency of care needs. C. Allocating equal time to each patient, regardless of their current condition. D. Delegating all non-nursing tasks to unlicensed assistive personnel to focus on documentation. Correct answer. B. Rationale. B is the most effective time management strategy, ensuring that patients with the highest acuity and most urgent care needs are attended to first. This approach maximizes patient safety and care quality by prioritizing based on clinical need rather than convenience or non-clinical factors. A may neglect the needs of less cooperative or more critically ill patients. C does not account for the varying needs of patients and may lead to inefficient care delivery. D, while delegation is important, must be balanced and appropriate, ensuring that tasks are delegated to personnel with the correct skills and that the nurse remains involved in direct patient care as needed. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.